tummy tucks, eye lifts, lipo. We are covering the gamut here. I've got Carolina Plastic Surgery, Dr. John Lettieri, who is a plastic surgeon from Carolina Plastic Surgery. Thanks for coming back.
Thank you.
Well, you may remember last week, Kimberly and I talked with Dr. Lettieri. We talked all about breast augmentations and different types of implants now that you offer. And today we're moving on to more surgical procedures.
Right.
So tell us a little bit about what you offer at Carolina Plastic Surgery.
Well, Megan, we talked a little bit last week how even with breast surgeries that could be done, what other techniques or procedures might patients ask to have. So those would include the broad variety of cosmetic procedures such as liposuction, body contouring techniques such as tummy tucks, facelift, eyelid surgery. So many of them can be done along with breast procedures or independently if that's what the patient chooses.
So you could go in kind of for a one-day stop shop, like I need this, this, and this.
Well, to some degree, you know, the TV shows, the ultimate makeover type shows misrepresented a little bit. So we take the position of safety first.
Of course.
Patients often request certain things to be done together. Sometimes they can be, and other times we might suggest that they break those into two different procedures.
Well, a lot of these things seem like, gosh, I'm going to go in, it looks like I'm going to be in the hospital for a week or so, but that's not the case.
Yeah, fortunately, and most people are pleasantly surprised about this, is that they go home the same day. So it's really the rare occasion where a patient either chooses to be or will recommend that they stay overnight in the hospital, but it's pretty uncommon.
Well, let's say, I want to go in and I want to do, a facelift. What's a good candidate for someone? Are there certain ages? Or?
Well, the ages have changed a bit over the years, so we're seeing younger and younger people now, since we're able to incorporate limited incision techniques, which make the scars almost imperceptible.
They sound less painful, too.
Yeah, so probably in the late 40s is the age where we begin seeing patients, men and women, by the way, for facelift surgery. And then right on up, I think the oldest patient was in her 80s.
In her 80s. I like it. Still wanting to look good.
Yeah.
And you bring up a good point with men, because a lot of these surgeries we think it's just, for the ladies, but men, they're starting to come in a lot more.
Right. So with the non-surgical techniques, which we've spoken of before, such as Botox, men are opting for that. I think men are often interested in body contouring techniques. I think there's a photo we might be showing here this morning about a man who had liposuction of his chest, tummy tucks in men, pretty common, facelifts also.
That's funny, because I was going to joke and be like, I bet a lot of men aren't doing the tummy tucks, but that's more for the women, but they are.
Yeah, well, sometimes it's associated with significant weight loss.
Right.
Bariatric surgery, gastric bypass surgery being very popular now for men and women. They're left with a lot of loose skin, so this is a common reason why those patients, both men and women, would seek some type of corrective surgery.
Because they've been so forward, have gotten so good looking, that loose skin.
Right, it's in the way, yeah.
So is that like what a good candidate is for a tummy tuck? And what's the difference, I guess, between tummy tuck and the lipo?
Right, so just exactly that. If there's loose skin involved, whether it's the face or the tummy, unless you do something about the loose skin, just removing a bit of fat underneath the skin won't quite do it. Often we're incorporating liposuction with the tummy tuck, but when there's loose skin, they're going to need that skin tightened.
Because a lot of, the loose skin, too, you can keep losing the weight, but the skin's not going to go anywhere, right?
Skin will get looser. Yeah, so it could be pregnancy related or weight loss related or both.
Well, both. Well, that's great. Now, we talked about, the recovery time. I guess it's different for each procedure.
Sure, yeah. Some procedures, such as eyelid surgery, most people can be back doing basic things, going to an office-type setting in a week.
Oh, wow.
Many of the other techniques, maybe a couple of weeks, 3 weeks at the most, but up and around the day of surgery. So it's no longer the thought of going home, getting in bed, and just staying there for days on end.
Walking around, you see all the things where they're all...
Right, so we want people to be mobilized very quickly, and the modern techniques allow for quicker recovery.
Well, that's great. And if someone is interested in any of these, how do they need to get the ball rolling to start doing this?
Yeah, they can contact our office. I think the contact information has been shown, or my website is drlettieri.com. Lots of good information. We show before and after photos there as well.
Well, that's great. I mean, the before and afters, they do it justice. On your website, too, you have a ton of great photos. So I suggest if you're interested in any of this, go check it out, see, for yourself, because it's not for everybody, but for someone that is considering it. And this is kind of a life change. This could be life-changing.
Right. So that's why the consultation we take very seriously. I see every patient in the consultation, and it gives us an opportunity to help educate the patient and understand exactly what their needs are.
What their needs are. Well, if you are enjoying these segments as much as we are, we're going to keep them around. You're going to come back on the 30th.
On the 30th.
And we have some other great things to talk to you about. Again, Dr. John Lettieri from Carolina Plastic Surgery.
Thank you.
So thank you so much for joining.